Hello everyone, this is Taylor of Rejuve Medical Fitness. Hope you're having a great day. Today's video, I would just like to talk to you guys about something that I think a lot of us don't consider while we're exercising, and that is alignment and control of the Thoracopelvic Cylinder, which from now on will be referred to as the TPC. So the TPC encompasses the spine, the rib cage, and the pelvis, and it's kind of interchangeable with the word core. So let's just briefly chat a little bit more about the core. So I think everyone at some point has probably heard that they have a weak core or they need to do more core strengthening, especially if you've had a lower back issue. And typically the core is thought to be the stomach muscles, and that you need to do things like crunches and sit-ups to strengthen those muscles. And that's not an entirely correct assumption. So what is the core really? Well, the best concept that I have seen up to this point is Dr. Evan Osar's concept that the core is the TPC, which we'll be talking a bit more about in a second here. So if we take a look at our skeleton, the only bony connection that we have between our rib cage and our pelvis is in the back with our spine. So in the front, we don't have that. All we have is our core to be able to connect those two parts of the body together. So this is where the instability comes in. So if your core is not strong enough or functional enough to connect those two parts of the body, that's where you will have problems. So the core is actually made up of multiple layers of thin muscles and not just these six-pack muscles that we're probably told to train with crunches and sit-ups. In fact, the core involves a lot of muscles that actually wrap all the way around the midsection into the back. So when we're training the core, we need to do more than just flexion exercises. We also need to do extension exercises for the low back. We also need to do rotational exercises and anti-rotational exercises. So rather than just doing crunches or sit-ups, you could do a plank on a Swiss ball, you could do dead bugs, bird dog. There's lots of better options for core exercises. So what is the TPC exactly referring to? Well, let's just kind of break down the word. So we have thoraco, which refers to the thorax. We have the pelvis or pelvic area. And then the cylinder is just to help us visualize our ribs kind of as some stacked rings in a cylindrical shape over top of our pelvis. So in essence, when we talk about alignment and control of the TPC, it's just simply how well we can control our thorax over our pelvis. So that's hopefully fairly simple to think about there. So why is alignment and control of the TPC so important? Well, when you can't properly align your TPC over your base of support or your feet and ankles, it's going to lead to a whole host of problems, including muscular imbalances and lots of compensatory patterns, which is going to lead to a lot of inoptimal strategies down the line. So let's take a look at one of these inoptimal strategies, the posterior pelvic tilt. So it kind of looks like this, and you can clearly see that my TPC is not very well aligned. So my thorax is way behind where my pelvis is. And the problem with this kind of pattern is that my quads have to work extra hard in order to maintain this position. It's going to cause a lot of tightness in my hip flexors and my quads, which is going to cause a lot of pulling on my kneecap, pulling it in towards the knee joint, causing knee pain, a lot of problems, and of course, you're not really going to even be able to squat properly when you hold this position all the time. I'll just go over another couple of suboptimal positions that are seen commonly. The next one looks maybe a little bit better, the military posture, which may look okay from the front, but when you look from the side here, you can tell that the thorax is actually behind the pelvis again, causing the lower back to be overactivated, causing a lot of problems down there. Another position that's commonly seen, maybe more with elderly people, is this kind of hyperkyphotic position. And once again, this is where thorax is behind the pelvis, causing a lot of stress on the body. And then the sway back position that a lot of moms seem to be commonly in, one I was kind of showing already. Once again, pelvis and thorax are not very well aligned, causing a lot of stress on the body. So what ideally we would like to look for is proper alignment of just simply the shoulders down to the hips, down to the ankles. Nice straight line drawn between those three spots. So the goal with learning how to control our TPC is not to force perfect posture, because that requires a lot of conscious control and a lot of effort to uphold. So for example, if I just demo keeping upright posture, bracing my core, it may look good, but that's just not realistic to be able to hold over a lot of time, and it's just not going to feel natural. So what we actually want to do is just learn how to properly align and control our TPC throughout a lot of movements and exercises. And once we've done that, we're going to build a habit, and over time it will feel a lot more natural. Now let's take a look at the hip hinge pattern. So when I go into the hinge, this may seem like an unaligned position, but when I actually pause in that position, what you can see is that my shoulders are aligned with my hips, and my hips are aligned underneath my base of support. So this is actually proper control of the TPC going into this movement. Now, if I was to do this movement with posterior pelvic tilt, too much of it, and I try to go into a hip hinge, it just looks very uncomfortable. And I do feel excessive stress on my low back because I don't have proper control of the TPC. So just as a final take-home message, if I show you guys one more exercise, I'm just going to grab a band here. The next time you're doing an exercise, I'd like you to think of the word TPC. And when you hear that word, I want you to cue up a couple of things. Number one, upright posture. Number two, core engaged, so the belly button's pulling in towards the spine. And then three, keeping the alignment of the shoulders, hips, and your base of support. And as you're doing that exercise, you should notice that it is a lot more comfortable and a lot more beneficial. Very good. So I hope that was helpful for you guys. If you did learn something from this video, please like and subscribe. And as well, if you want some more information on our services, please visit www.rejuvfitness.ca. We will see you in the next video.